Welcome to the meeting. You have 5 minutes to present your deputation to the council. I understand that you will be splitting it because there's 2 speakers. That's absolutely fine. You do that how you need to on your side. Okay, over to you.
Thank you. My name's Sarah. I'm speaking today because my mum Janet is a resident at Castle Grange. It has been well documented that Kirklees Council needs to save money and fast. So maybe the risk of diluting care for the residents of Castle Grange and Claremont House is worth it. Maybe the risk of deterioration and a lower quality of life for these vulnerable residents is worth it. Maybe the risk of attacking staff terms and conditions and experienced staff leaving is worth it. But is it really? The figures Kirklees Council have presented themselves don't add up. Kirklees claim that they will save £1.8 million a year by privatising our specialist dementia care homes. The 2023-24 total cost per person per week to run Castle Grange and Claremont House is £1,290. This is close to the regional average for specialist residential dementia care across Yorkshire and Humber. £853 is the contribution that Kirklees state they can get away with paying if they transfer the homes to a private operator. But costs won't disappear with a new name above the door. So who will pay the difference? Will residents and their families be left with an extra £437 per week to find? Does Kirklees have a plan to subsidise this cost? This information remains unclear. 2021 figures show a stark contrast in affordability versus standards, and costs have increased by over 20% since then. In 2024, Kirklees' £853 per person per week will now fall in the inadequate CQC rating. Residents who cannot self-fund or provide third-party top-ups will end up here. This amounts to disability discrimination under the Equalities Act 2010. What will happen to quality, I hear you ask? To ensure that they make their profits without increasing costs, private operators will have to cut the quality of care, which means cutting staff budgets, training, equipment, maintenance and supplies. Why is this a problem? Lower staff and training budgets result in reduced quality and dignity of life, higher workload for remaining staff, greater risk to welfare and increased costs to local healthcare services. The CQC have identified that workforce shortages are a significant ongoing challenge. In 2023, there were 165,000 unfilled vacancies. When private operators provide less favourable employment terms and benefits, potential workers inevitably choose other sectors. In summary, Kirklees saves £1.8 million per year, but staff lose. Staff lose financial stability, jobs, training and self-worth. Residents lose. Residents lose quality and dignity of care or are forced to pay more for it, which is illegal discrimination on the grounds of disability. And other public sector agencies, such as the NHS, lose by experiencing higher costs due to higher levels of injury and other health conditions in the private sector. In the Cabinet meeting on the 8th of October, where this disastrous proposal was given the go-ahead, Councillor Khan made some very poignant points. This is a high-risk strategy. There were specific reasons why the decision was taken to deliver dementia care in-house. The high-end needs of dementia care require a lot of staff and 24-hour supervision, and we know that this is not profitable. We know it's not possible for the private sector to gain profit out of that without cutting quality. The Council won't have any legal standing to ensure that a private operator takes on these high-end needs. We also know, as a fact, that quality of care is related to staff conditions such as wages, training, expertise and stability. Lower turnover equals better quality services, and the Council will lose the power to affect these things.
But what evidence do we have that private sector can't meet our loved ones' needs? We have been collating heartbreaking stories from families of both Castle Grange and Claremont to gain an understanding of their experiences, which demonstrates why we have continually expressed our worries and fears about private sector care. Quite simply, private-owned care homes put profit before care. We all know that. We have gathered information from families who have had experience of privately owned care homes, and the incidents and actions of these care homes are horrific. Here are some examples, and please be aware, these are from care homes rated good by CQC, the same care homes that Councillor Addy claims to be high-quality providers. Unwitnessed falls that result in broken hips, unexplained unwitnessed falls, blood and bruises, A resident kept in bed with their feet enraced so they couldn't get out. Residents left in soiled underwear. A resident with celiac only being given a biscuit for breakfast. Help with eating not offered and the meal being removed assuming they don't want it. These are all facts, they're not made up, and the families are willing to speak up publicly about them. What does happen in privately owned care homes is that staff levels are cut to the minimum, staff not qualified to care, such as the receptionist and maintenance staff, are included in care staff numbers. This not only restricts what the residents are allowed to do, but it's dangerous, hence the unwitness falls. Doors are locked because they say residents don't always get on with each other. They don't take residents who need help with feeding, as they are too time-consuming. Residents are medicated or kept in bed so they are more manageable. My mum was medicated for this reason in 2 private care homes, both rated good by CQC. Yet within a week of being at Claremont, staff questioned this and mum didn't need it. She was medicated for over 2 years for no reason, other than to make people's job easier and the company's more profit. Managers receive a bonus for admitting self-funded fee payers over local authority and for saving money in the kitchen, so cheaper and limited food options are given. In contrast, 2 examples of care at Claremont and Castle Grange are one lady walks all day. She's the run of the home and can walk freely whether it's night or day. The doors aren't locked, no one says you can't go there, no. Another resident is immobile and non-verbal. It would be easy and much less time consuming for the carers just to leave this resident in bed 24/7. But every day she gets up and she's involved and never left on her own. This most definitely would not happen in the private sector. The difference between Castle Grange and Claremont and privately owned homes is huge and very clear. You all have the power to decide which direction the latter years of our loved one goes, and we urge you to put yourself in our shoes and do the right thing for these vulnerable, unwell, reliant and much loved Kirklees residents.
Thank you. Could I ask Councillor Addy to respond, please? Thank you.
Once again, I have to reiterate that we don't find ourselves in this position lightly. We found ourselves in the position where we thought we would have to close the care homes. We've come to another option which was asked for, and we've brought this forward. We're not closing them. You've made some quite damning assertions about the private sector care that most of our dementia care residents live in. And it would be really helpful, because when care fails, it needs reporting and pulling up if we got the details of where and when these things happened. And I'm very happy to try and take that forward for you, because that is how we make sure we stay on top of places where things do fall down. But I'm not sure I entirely recognise this as the general picture of the independent sector. We work closely with the independent sector. I don't think it's a fair generalisation about the majority of residential dementia care facilities in Kirklees. This is where most people are provided with their care. We only have 2 care homes. And there's no reason to believe care will be lower when we move into the private sector. We are looking at quality care. We are looking to move into a quality care provider. You asked some specifics. So how will Kirklees ensure fees are not exceed a sustainable and manageable rate for families? Under the 2014 Care Act, the Council has a specific set of duties and responsibilities to ensure people receive the right care and support against a charging framework that's fair and transparent, including means testing. The Council conducts a financial assessment to determine how much an individual can afford to contribute towards their care costs. And setting fee rates. The Council sets a standard fee structure for services which helps manage costs by ensuring that providers charge within these limits. You can see details of these on the Council's website. And negotiating contracts. The Council regularly engages with the wider provider market to negotiate contracts with a view to securing a fair price for services which can help manage the overall cost to service users. And how will Kirklees guarantee that standards of care will remain the same for your loved ones for all our loved ones, that staff ratio will reflect need. The Council has a crucial role in working with Kirklees Care Association and wider care providers to ensure good standards of care are met and that staffing is in line with the needs of the residents. In the Health and Social Care Act 2008 and regulations in 2014, in relation to staffing, it states that sufficient numbers of suitably qualified, competent, skilled and experienced persons must be deployed in order to meet the requirements of this. In summary, this means that all care providers must ensure that they deploy enough qualified, competent and experienced staff to enable them to meet care needs of residents and meet their regulatory requirements. The Council and the ICB also have a robust process of contract monitoring and quality assuring care homes in Kirklees. A range of professionals visit care homes on a daily basis. There is also a schedule of visits planned throughout the year, carried out by the Council's care home contract and quality team, alongside NHS partners. Care homes are also inspected by the Care Quality Commission. These inspectors assess various aspects of care, including safety, effectiveness and staffing levels. The CQC ensures that care homes comply with fundamental standards and can take action if they fall short. And families and friends and partners visit care homes every day. And if you report anything you see that's inappropriate, anything you see that's wrong, that's where we can carry on monitoring and take action.
So thank you for attending the meeting and thank you, Councillor Addy, for your response. Are there any other deputations? No. Are there any public petitions? No. Okay. I'm going to move on to agenda item 7, which is public question time. So 3 public questions have been received and responses have been circulated. Supplementary questions will be permitted if the person who submitted the question is present at the meeting. So can I please invite Mike Foster to ask the supplementary question to question 1, please?
Thank you. For those of you who haven't seen the question that we submitted and the answer that Councillor Addy provided, I'll just remind you, which is coming back to the figures that were mentioned earlier. According to the Cabinet figures, the homes currently cost £1,290 per person per week to run, but the Cabinet is suggesting the private sector will be able to run them for £853. Our question was, that leaves a shortfall of £437. How will that be addressed? I think that Councillor Addy has so far failed to answer that in her response to the deputation. But in her written submission to us, she said the difference is accounted for by independent sector providers.
Mike, can I just stop you there, please? Could you move on to the supplementary?
Yes, I'm just enlightening the council as to what the response was.
They've already seen them. They've already seen the question and they should have already seen the answer.
I'm pleased you've got them and I hope that you've read them then.
As I was unable to attend the council meeting last time, I watched online, and this is very salient. When people are watching online, the public have got no idea of the initial question. It's throwing somebody in at the deep end. For goodness sake, can't we at least have the question, then we know what it relates to?
The questions... Members have already had the questions and the answers. So for if you just let me finish. So members have already had the questions and the answers. So you should already know the background to the supplementary. In terms of members of the public who are watching online or in the reception room, this is something that we can take back to the next, the next Audit and Governance Committee meeting. When we have a response, I can come back and brief the council. But for now, we are going to stick to the council rules. So, Mike, could you please ask the supplementary? Thank you.
Well, I was halfway through Councillor Addy's answer. The difference, he said, is accounted for by independent sector providers having lower operating costs than the council. In any event, residential care is means tested, so individuals using services only contribute
Mike, I'm going to have to stop you again.
That they have been assessed
you
as
either ask the supplementary, what you've been invited to do, and if not, I'm going to ask you to leave. I'm going to have to ask you to leave. I
haven't asked the question yet.
I've explained the process quite clearly. You're here to ask a supplementary question, not read out the answer to your original question. So if you've got a supplementary, I'll give you another chance to ask the supplementary, and if you're not going to ask the supplementary, I'm going to ask you to kindly leave.
Thank you, Chair. The supplementary question is as follows. Councillor Addy leaves a lot of unfilled gaps and further questions which will be explored at length by our campaign. But surely the private sector, and we call it the private sector, I'm not sure why the Cabinet insists on calling it independent. These are for-profit private companies like Severn Water or the Post Office, for example, both highly regulated but constantly failing in their legal duties to bill payers and sub-postmasters. But, in our opinion, and in terms of the question, can the private sector run their homes for less because they will be blatantly cutting staffing costs, as the Cabinet report clearly states? Does the Cabinet agree with the Institute of Financial Studies that low-paid and unsupported staff will produce worse results than well-supported staff with decent paying conditions? Except in this case, these clients are not widgets. They are the most vulnerable people in society who need our care and support. And if individuals will only be contributing what they can afford for their care in the private sector, who will make up the difference? If it is the council that's going to make up the difference, then where do you expect to save money? Especially as you anticipate not recouping the full value of the homes when you sell them off as a going concern.
Could I invite Councillor Addy to respond, please? Thank you. And again, respond to the supplementary, please.
The independent sector or private sector, whichever phrase we're using, can make savings. The council with just 2 care homes can't. The Cabinet report dated 8th of October 2024 utilising an estimated market rate expressed as a unit cost per bed per week of £853. This equates to the average cost to the council based on the full range of contracted dementia beds across Kirklees. Any difference in care costs will be governed through the council's charging framework and fee structure for care services. The council will continue to contribute to care costs for low-income residents based on the outcome of a financial assessment. This applies to most of our existing residents across the 2 homes. The contribution will be applicable for the client whether they are in an external home or in a council-provided care home. As I pointed out earlier, most of our dementia care residential clients are in the independent sector already. They would contribute the same amount as it would be dependent on their independent ability to contribute through a financial means test. It's not based on the actual cost of a residential bed. Service users who meet the threshold for financial support will be supported in line with the charging policy following a financial assessment. Service users who self-fund their care will involve a private arrangement between the service user, family representative and the care provider. This arrangement will vary across each care home. Thank you.
Thank you, Councillor Addy. Thank you, Mr Forster. Could I please invite Sarah Newton to ask the supplementary question to question 2? And could I just remind members and members of the public, we do only have 15 minutes for this item, so I would prefer the people that are here with their supplementaries, they get the opportunity for their supplementaries questions to be asked and then the answers to be heard. So, Sarah, when you're ready, please.
When I chose Castle Grange for my dad Ernest, this is Ernest. Thanks for looking, Councillor Addy, this is my dad. By that I meant you didn't. It was because it was dementia only. And the design of the building as a dementia-only care home meant it could maintain his freedom, which he needed because he gets anxiety, and it increases his behaviours caused by dementia. When I went round and viewed many dementia homes, as you call them, they're not full dementia homes. They are care homes that have a section that deals with dementia. These are areas of a care home where our loved ones are locked away upstairs without freedom of movement, that have to be accompanied through every door, which increases anxiety levels. I didn't want that for my dad. I chose Castle Grange because I didn't. In your response, it was very tick box procedural response, which I expect from the council after our last campaign. But it doesn't answer my question or my main concerns, which is, will my dad be locked away on a dementia floor if the ownership is transferred?
I apologise for not looking at the time you pointed out. I was writing down notes about what you were saying. So, while I appreciate your fears, this home is being transferred as it is. It's being transferred to dementia specialists, people who specialise in dementia care. And what you have witnessed somewhere, I have not seen in other care homes. People may have access to this area, lounges, to their rooms. I haven't seen people locked away. And of course, there are strict rules about how people can be treated. So into the future, we'll be passing on Castle Grange as it is to a dementia care provider. And I would like to think that Ernest will continue to have that freedom in there. That is what we are aiming to pass on to specialists who will look after those residents as they're looked after now.
You said light.
Sorry, Sarah, you don't get another supplementary.
She doesn't answer, sorry.
So, if you've got a question, you've answered. Have you answered, Councillor Addy? Sarah, you have another question. I'm going to ask you to move on to the other question that you've got, please.
Right. Since our loved ones, relatives of Kirklees, have had very different experiences of the private sector, resulting in them moving their loved ones from dementia care homes in the private sector within Kirklees to the specialist dementia care home that is Castle Grange and Claremont House. You can understand why we remain extremely fearful of the effects this may lead to early decline of our loved ones who are suffering from dementia, because changing staff of what's happening around them can all instigate that. So if you know dementia, you will know that is a fact. So with those concerns, we'd like you to actually take our concerns into consideration, and we don't want you to do this, I wouldn't call it a consultation that you're doing at the moment, dividing us off one by one to speak to. I would like you, Councillor Addy, to come and speak with the relatives to understand what this means to us and our loved ones. And I would like you, because in your written response you said that you can write into establish contractual agreements, I would like you to come and listen to us and to take away what is right to ensure those contractual agreements are met, such as they can't change the use for 10 years, which would be the life expectancy of our loved ones. And whilst we're on that subject, can you also clarify, because you keep correcting us and saying there's a difference between specialist dementia care and a home that specialises in dementia. Can you please clarify that to us, because I don't see the difference.
Could I invite Councillor Addy to respond, please?
Last bit first. I think what I've been trying to say is that there is no difference. A specialist dementia care at home that specialises in dementia care is the same. Castle Grange and Claremont House are the same as the private providers who have dementia care homes that specialise in dementia care.
They're not.
You just told me that they're the same, and I'm trying to clarify that for you. There is no definition under the care homes that differentiates between those two things. They don't have anything at Claremont House and Castle Grange that is different to that. It is one thing. And then you've referred to the future. Now, we can guarantee so far into the future we can pick the right provider. But in 10 years' time, we had no idea. We were going to have to close these homes, and that's where we got to in the future of these. Now we're looking to a future where we transfer them wholesale. So you talk about changes. We're hoping that we'll be able to transfer everything wholesale. So the residents will still have the residents around them that they know, the staff around them that they know. There are no guarantees into the future, but I'm happy to come and listen to you and hear you. As a group of residents, our consultation is individual. The official consultation is individual, so we can look at individual people's needs, individual fears, without people being sidelined and at the back of the room who can't get to say what they need to say about their individual relatives. But if you want to talk to me as a group, I will come and listen. But I can't take that as that's not part of the consultation. That is you talking to me. The consultation is going to be with individual families, because then individual needs are looked at, and that is very important.
My family can't
Thank you, Councillor Addy,
those.
and thank you, Sarah Newton.
Selected views.
Thank you. I just want to take this opportunity to remind